16 in the KU-Wave News Zoom room. Let's bring on Hospital Administrator Lillian Posadas. Good morning, Lillian.
Hi. Good morning. How are you all?
We're doing all right. How are you?
Doing good. We're doing good.
Holding
We
it,
stay the
holding in there.
course. We stay the course and we continue the fight.
Right,
On this,
we're staying the
brutal,
course, right, Lillian? The waters are getting pretty rough. So just if you
Yeah.
could, give us a situation report at the Guam Memorial Hospital.
Okay. Right now we have 14 COVID individuals in the house. 4 of them are in the Care 2 unit, which is our pretty much ICU level of care unit. And then the fourth floor Care 3, we now have 10. We discharged 2 yesterday, but we admitted 3 during the night and early this morning. So we are at 14 total.
Yeah, 14. So what did I don't even know where to start. That's just crazy.
I guess we could start on, if you could, Lillian, without revealing too much, tell us the status of these hospitalizations.
Well, the 4 that are in the Care 2 are the same individuals who've been there since last week. The individual who's in the age range of 30 still on the ventilator. The other individual who is around 50 plus years old is on a CPAP, which is a continuous pressure, oxygen flow. It's not a ventilator where the individual is intubated, but it is a supplemental oxygen on a continuous basis. The other 2 individuals are also on oxygen high flow nasal cannula. This is a form of a supplemental oxygen that is delivered through almost like a nasal cannula, the same concept, but it's a thicker nasal cannula tubing where it delivers, it can deliver a maximum of 100% O2, and it's heated, it's humidified, so that way the nostrils are not irritated. But it definitely is something that you can guarantee the individual gets 100% versus the regular nasal cannula. You can't guarantee that 100% will be delivered to the individual's lungs. The most it can get on that basic simple nasal cannula that you see commonly used is like about 45%. But the difference with this high flow nasal cannula is that it's heated and it's humidified to help the secretions and to make sure that the individual gets 100% oxygen. The 10 individuals in Care 4, age ranges between the 30s to late 60s. And so that's what we've got. It's a combination of, female and male individuals with different comorbidities. And they are receiving supplemental oxygen also. It may not necessarily be the high flow nasal cannula, but, they are getting some oxygen supply through the nasal cannula. And they're stable for now. And so, again, I just want to take this opportunity to emphasize that, please, really everybody just take heed of the warning that we need to make sure we put on that mask, we exercise, we practice social distancing, because you never know. This virus it's a cunning virus. You could be standing, as Adriana said last night, you could be standing behind somebody and, the virus just jumps on you. It's a brutal virus. It's a brute, very cunning. So you never know where you can get it. And so really, again, we need to make sure we exercise these preventive measures. Because can you imagine, I don't know, most of you have probably had the flu, right? And it hurts. Even your skin sometimes hurts. Your head hurts. Can you imagine this virus? That's quite brutal. And, if it gets on your lungs, primarily attacks your lungs. And so can you imagine the pain that you can feel, when you have this virus? And so, again, that's the seriousness. Not only the pain, but the oxygen level that you may not be getting into your lungs and into your systems.
Right.
So this is a very serious matter.
Lillian, can you kind of walk us through, so the people who are getting the additional oxygen, Maybe on the escalation scale, what happens when they go from, being okay to having to get the oxygen to that end step of being on the ventilator? What is it about the COVID attacking their lungs that causes those different situations in their care?
Well, when you have the infection in your lungs, of course, your normal body reaction is that it secretes. It has secretions in your lungs, and when those secretions build up in your lungs, it prevents your lungs from getting the full oxygenation. You have a hard time breathing, even though as much as you try and breathe, you're not getting the adequate oxygen into your lungs, and so you end up what we call desaturation. Your oxygen level drops, and so you're going to need to then, and you're struggling to breathe and get that oxygen into your lungs, and so eventually you're going to be worn out, you're going to tap out, and so you need to have that ventilator support and let that ventilator work for you to get the oxygen into your lung tissues, and so you're going to so you can get well oxygenated as much as possible.
During PCOR 1, I'm not PCOR 1, the first wave, there was all this talk about having, like field hospitals working with the Army Corps of Engineers. And as we've seen these numbers going up and the hospitalizations going up, have we re-engaged in those discussions about the need to have this extra support to provide?
Absolutely, yeah. The governor shared with us yesterday at the ops meeting that she has been in communication, with Admiral Minoni, and that they are ready to, as soon as we reach a trigger point where we've maxed out with our bed capacity, and if we're not able to get the SIF with the chiller, then, and the governor ordered, Homeland Security and Office of Civil Defense to get those blue medical tents purchased, and so we can stage them right outside of the hospital as if we need them. So the military already has been, according to the governor, that Admiral Maloney has been just keeping a close watch with our census and how our numbers are rising, and so they're prepared to respond to the governor's call for help.
You said reaching that trigger point. What is the trigger point?
Well, right now with our acute care capacity, we have about 29 plus 2 beds in the ER isolation. So that's like about 31. If we're reaching, the 25 or the 29 bed capacity and we can't accommodate anymore, then most likely that may be the trigger point, especially if our SIF is not yet up and open. So that may be the trigger point. I haven't yet discussed or decided with the governor what will be the trigger point, but we just have to maximize our capacity according to what HHS has briefed us previously. In order for the cavalry to be activated and come to deploy to come to GMH or to Guam, we need to reach our capacity. And I understand it's not just Guam Memorial Hospital, but also all the hospital facilities. If we reach our maximum capacity, that will be the trigger point, is what I understand. That may have changed. I don't know.
So where are we with the chiller acquisition?
Okay, we've signed, I signed the purchase order for the temporary chiller that is being donated to us from a private company on island. And so it's two 160 ton chillers. So we're going to get one hopefully transported from that facility up to the SIF SNF, hopefully this week, get it installed, get it commissioned and operational. If not this week, then next week. We're hoping to get it done as soon as possible, but a lot of things are out of our control.
Right, right.
And so we keep pushing. We keep pushing for it to get done.
Lillian, can you give us a status, as we had got a tip, and again, one of it, if you could verify or not verify that Days Inn, that's the isolation facility. Is that at capacity?
You know what? I don't have any authority or jurisdiction
I see.
over it. We support the Days Inn facility as far as laundry and trash collection, but as far as managing it, it's under the authority and jurisdiction of public health. I don't know anymore what the capacity is because there were some public health staff who were there, because they're the ones managing it.
Right.
But they've moved them out so that way to have more rooms for individuals who need to be in isolation, continuous isolation.
Yeah, according to the SIT report yesterday, the isolation facility is 31. And I think when we
31.
talked last week, you were mentioning that the capacity is anywhere between 40 to 50.
Yeah,
And
that's my understanding, but then I guess that got changed.
yeah, and I know when the governor was on also last week, it does change because some come in and then they're constantly going in and out based on the
Right.
number of days that they were at the isolation facility.
But
Lillian,
some of the rooms may not be occupiable for
right.
whatever,
Uh,
reason that, it cannot be occupied.
I kind of want to go back to the frontliners and the staff of the hospital. As you know, we've seen the COVID hit a few prominent doctors, right? And so
Right.
I'm just wondering with the staff, how are they coping in that we were in that real stretch where it seemed like we were just done. There was 0, 0, 1, 1 was 0. It looked like binary code. But now here we are. So what's the mindset of the staff? I mean, did that calm period kind of allow them to kind of recoup, or what are they saying to you?
Well, of course, they're still worried. And of course, we are still providing them, again, that additional layer of safety for them, meaning accommodations, lodgings at the hotel. We've extended that. We're continuing to provide that for them so that it helps with their anxiety, bringing home, if anything, whatever, transmission that's possible. So we've given them that additional layer of protection. And so, for the most part, the staff, and knock on wood, they really are adhering to the PPE practice and putting on their PPE gear and tools, and then donning them off properly when they're done. So that way, it really has minimized any infection among the staff. Knock on wood, we haven't had any staff, convert to being COVID positive. So that's a good sign that they are adhering to the PPEs and practicing, the measures, prevention measures. And so, for the most part, the staff are, doing whatever they can do to take care of these patients. I haven't heard much of any complaints or dissatisfaction. Of course, anxiety is still there, but I think the anxiety has minimized because we make sure that we provide them with the PPE gear and equipment and supplies.
You talk about staff. Well, what about staffing? Are you guys, because of the anxiety increasing and because of, the surge in positive cases, have you had staff that have just said, I just can't do this anymore and have resigned? And if so, how many people are we talking?
We have had some people in the very beginning resign because they're afraid of this COVID. They didn't want to work in this environment. And we have continuously received resignations from staff nurses, for different reasons. They want to move on to work in a different setting, such as the school or in a clinic. Several of them have gone on. I've gone back to pursuing a master's degree. There was one nurse, who has worked many years in a hospital setting here and abroad, and he just basically said he can't do hospital nursing anymore. And understandably so. It's hard work working in a hospital setting. You're required to know practically every medication that you're giving to a patient, the pathophysiological process of the medical conditions of the patient, the adverse effects of the medication. I mean, just a whole gamut of knowledge and critical thinking skills that you need to possess. At the same time, you're walking the miles on the floors, constantly on the floors, working, assessing the patients, and checking on their conditions as far as listening to their lungs, listening to their hearts, knowing what's going on, what symptoms may be a sign of adverse effects from medications, and a lot of psychomotor skills that you need to have, such as inserting an IV, sinking an NG tube, suctioning a tracheostomy, all of that. It's a vast knowledge that you must possess. And so, yeah, it can take a strain on individuals, and particularly with this pandemic. And that's why all the more reason we really, really, really urge the public to take care and prevent yourself from getting this COVID infection, prevent your family from contracting it as much as you can.
Are these resignations, though, how much of a concern is it for you as the administrator, seeing people that are walking away from GMH and still being able to provide the care that we're needing during this surge and just going forward?
Yeah, it's a concern. Every time I see a resignation letter come across my desk, it's like, oh man, we're losing. But at the same time, we're also recruiting nurses. We recruited 14 of the 26 UOG BSN graduates. We've recruited them as graduate nurses. So we have an amazing team. We have an amazing staff who are just really, doing their very best and mentoring these new nurses that come in. We are able to get additional travel nurses with the experience working in ER and ICU. So, and then we've got, nurses in the OR or in the other areas that when the census is down, they are very willing and to help in the other areas, especially in the COVID areas. And so we've got a great team of individuals who are just really working, you know, really just out there. They're committed. They're very dedicated and are committed. And we don't hear a whole lot. I don't hear a whole lot of nurses and other staff calling in sick. But if they do, we make sure we allow them that time off because they need to get re-energized and recuperate
Right.
from that. They need to rest.
I wanted to follow up on something you said earlier about the COVID care unit 2, and you said there were 4 people there?
Ma'am, there are 4 people in there.
Okay.
3 of those individuals are at the ICU level of care. One is at a progressive care unit level. That's kind of like a level between telemetry and ICU.
But they're still in the COVID care unit 2, right?
Absolutely, they're still there.
Okay. Yeah, I started to get confused with COVID care unit 2. That is the one that has 5 beds?
That has 5 beds, right? But right now, because it's kind of like a little cramped in there, and so safely, 4 really. We're trying to keep it at 4.
So are there plans to extend the number of beds in the COVID care 2 unit where the ICU level of care is being provided, considering the fact
There's
that we're
no more
seeing... Go
There's
ahead.
no more space in the ICU, in the Care 2 unit. It's a very small area between ER and ICU. There's no way to expand it. We do have Care 1 that we could use if we need to, but we also have the 2 rooms in ER, their isolation with the capacity for ICU care. But we don't want to clog up ER because, we continue to see patients come through. So as much as possible, we try and free up, when patients are ready to be moved out of there, transferred to an open bed, whether it's ICU or COVID-2 or COVID-3, we get them out. But yes, we are seriously looking at also decompressing the telemetry unit, which is the 3rd floor, and making that a Care 4 unit. It has about 6 beds on the Ocean View side that are basically called progressive care unit, and we can accommodate individuals who are critically ill on a ventilator. And so we're looking at using that either as a backup for ICU. But we need to clear out telemetry, and and the telemetry unit we have non-COVID patients. We need to find an alternate site, and we're looking at medical surgical. We're working with a company to get the central cardiac monitoring moved over or established there so that we can still have telemetry capability over in MedSearch for non-COVID telemetry patients.
Okay,
So we're continuously working to, get these rooms.
so because of
opened up.
the surge and these increasing number of positive cases, the Guam Memorial Hospital is now looking to open a COVID Care 4 unit.
Correct.
That's what you
Yes,
okay.
ma'am.
What about just regular ICU?
Yeah. I was going to ask Lillian too, just a combo with Sabrina's question. We've talked COVID. What about what I'm hearing, an avalanche of just other medical issues that people maybe have put off during the lockdown and the pandemic? Are we seeing a lot of hospitalizations for, non-COVID related illness?
Yes. Yes, we have. We have seen an increase in non-COVID. Our census continues to be over 110, 120 for non-COVID.
And then also, if you could, I saw that on the latest JIC, you guys have made some changes to your visiting, obviously with PCOR 1.
Right.
Yeah.
We again, our goal is to really protect the spread of this infection. So we've limited the hours. We've cut it down another hour. So it's really just from 5 to 7. And basically, we're just, we continue to have parents be with their hospitalized child, whether it's COVID or non-COVID. We do allow the parent to be there. And so, yes, we're restricting and we're limiting the traffic of, visitors and individuals who do not need to be here in the hospital. And back to your question, Sabrina, on the ICU. Yes, we have physically a 14-bed structure in the ICU. And right now, we are able to accommodate 8 patients in the ICU, where before we could only accommodate 6 non-COVID ICU. But we're trying again. We're preserving that ICU for non-COVID patients, and we're keeping that. And hopefully we get more nurses that then we can increase the capacity from 8 to hopefully maybe even 10 or even 12.
Are all 8 beds occupied?
Not right now. We have 6 beds occupied.
Oh, okay. So 2 beds are available.
Available. 2 beds are available if we get an ICU non-COVID patient in the ER that needs an inpatient bed in ICU. We can accommodate at least 2. We can accommodate 2 more.
Are there then plans to expand ICU, regular ICU?
That's been our plan. That's been our goal. But it's all contingent on getting critical care nurses.
Right.
Experienced critical care nurses. Yeah, that's really one of the criteria.
Lillian, in
Wow.
that JIC that came down, I saw with the visiting for the COVID patients, there was a little thing, and man, it kind of got me, where you talked about visiting for COVID patients who are minors or children, right? And I think it said that you're allowing the parents or the guardians to stay with the kids or the minors.
hospitalized child,
Right, yeah.
yes.
So I got to ask
We're
you,
allowed.
do we have any?
We've always allowed a parent. What's that?
Go ahead. Do we have any teens or children hospitalized with COVID right now?
Not right now. No, we don't. They're all adults.
Right. Okay.
Did you ask her? Did the visiting? Does it require that you get a test?
Yeah. Do you need a negative COVID test to visit people at GMH?
We haven't required that, but that may be an idea that we
Right.
may put into place. Just again to really minimize the spread of infection.
Right.
We want to make sure people coming in, we're checking their temperatures and we're asking some questions. And so, and we're keeping a log and their contact numbers just in case that there's exposure.
Right.
We can help public health do the contact tracing.
Right. Lillian, I want to.
No, you mentioned earlier that you really are in need of critical care nurses. How short are you guys on critical care nurses?
Wow, you know what? I don't have the number with me, but the last vacancy rate for the ICU. Oh gosh, I'm trying to remember what the number was, but in order for us to really fully maximize that 14 bed, 3 shifts a day, 7 days a week, probably need another 12 nurses, critical care nurses in ER, in the ICU. I'm just throwing that number without using a formula. There is a
Let's say
formula.
20. Yeah, we need 20. Let's go.
Go
Aim
high.
Lillian, I want to give you the last word because I know that even when we were in PCOR 3 and the openings, you've always kind of had the same tone as a voice of caution, right? And So again, I just want to give you the floor, closing words from the front line of the Guam Memorial Hospital.
Okay, well, thank you. Again, I just want to emphasize what we've been saying, what the governor's been saying, what the PAG's been saying. Please, let's heed to the warning that we need to all work with each other to fight this virus, not fight each other, but fight the virus. We need our collective minds, our collective efforts in order for all of us to get through this. And we will get through this, but we just have to work together and, remind each other, hey, put on your mask. I'm already told I need to wear a medical grade mask because I was using a cloth mask, face mask, but because of the increased census, I need to wear this medical grade mask. And so, again, people, please keep your mask on wherever you go, wash your hands, and stay home.
Stay home!
Stay home for now.
Can you say it like
Yeah.
that, Lillian? Can you do the mad one? Because that's the one that people listen to. When you say stay home, they're just like,
Stay home, or if you want, you can come into the hospital and get sick. Is that what you want?
Whoa!
There you go.
No, you don't want to come into the hospital. You don't want to be sick.
Right. Yeah.
There you go.
Thank you, Lillian.
Okay, thank
Keep,
you.
keep us
Take
posted.
care.
Right on. Okay. Wash your hands.
All right.
Well, there you go. There's from the numbers last night, we have another hospitalization, right?
Yeah, right now, according to Guam Memorial Hospital Administrator Lillian Posadas, we went from 13 to 14 hospitalizations over at the Guam Memorial Hospital. Some of the things that she mentioned was the fact that there was a ops meeting with the governor yesterday, and she instructed the ordering of blue field tents, something like that. And these are